Electrical activity of the heart constitutes two processes. One is the impulse generation and another is impulse conduction. Disturbance in any of the process leads to cardiac arrhythmias. We will learn about cardiac arrhythmias, but first of all, we will learn the normal impulse generation and conduction in the heart. All the cells of the heart are connected to each other via gap junctions. So, currents can flow from one cell to another cell efficiently and they are acting like a syncytium. So, we can see atrial cells are connected and form the atrial syncytium and ventricle cells are connected and forming the ventricular syncytium. These both syncytium are connected to each other by bundle of His that we will see later on. Such a design is important for synchronized electrical excitability of the heart. Further, all the heart cells are connected to each other mechanically via desmosomes. So these arrangements make heart an efficient pump. As we have learned, cells of the heart are connected via gap junctions. So what happens when one cell is depolarized and another one is still at a polarized state? So because of the difference in the potential, current will flow from these gap junctions. So it is the density of gap junctions between two cells that determines its conductivity. In addition, we have also talked about the slope of phase 0 of the cardiac potential that is also responsible for the conductivity. So we can say as far as conductivity of is concerned, we have learned about two factors. One is the density of gap junctions and another one is the slope of phase 0 of cardiac potential. So remember these two factors. We discussed about five types of myocardial cells. SN-nodal cells and AV nodal cells are specialized for impulse generation. Purkinje cells are specialized for conduction of the impulse, and atrial fibers and ventricular fibers are responsible for the contraction. First three types of cells form the electrical system of the heart. Electrical system of the heart constitutes the SN node, atrial bundles, AV node, bundle of His, also known as AV bundle, left and right bundle branch, and the Purkinje fibers. So this is the conduction system of the heart. Now talking about the impulse generation in the heart. The normal pacemaker of heart is the SA node. The intrinsic rate of SA node is 60 beats per minute. However, because of the sympathetic tone, it usually increases a bit. Now, in case of disease of sinus node or if there is any block, AV node may take over the pacemaker activity. The intrinsic rate of AV node is about 40 beats per minute to 60 beats per minute. In case of AV block, Purkinje fibers take over the activity and their intrinsic rate is about 15 to 40 beats per minute. So these are the impulse generative systems in our heart. Ectopic pacemaker activity can present itself in two scenarios. In scenario 1, as we know, SA node is the normal pacemaker. So here SA node is normal. However, because of some pathogenesis in the another part of the conduction system, some impulse arise there and take over the pacemaker activity. Such type of phenomena is known as premature ectopic activity. In scenario 2, there may be disease in the SA node or AV node and there may be some bundle block. The impulse is not able to transmit in the distal portion of the conduction system. So that portion may take over the activity, pacemaker activity. So we can say such type of ectopic pacemaker activity is due to the escape phenomena. We will learn in ECG how to differentiate between the premature and the escape ectopic activity. In association with escape phenomena, we can describe a term called Adams-Stokes syndrome. Meaning there is a sudden brief loss of consciousness due to reduced cardiac output. The cause may be some abnormal heart rhythm, and we can see escape phenomena may be one cause of this syndrome. Now, after impulse generation, we can talk about the impulse conduction system of the heart. Though all the myocardial cells are connected via gap junctions and impulse can be spread from cell to cell, but there is a specialized conducting system present in our heart. The aim of this conduction system is just the synchronized electrical excitability and contraction and pumping of the heart in an efficient way. Now we will talk about the atrial conduction system. Once impulse is originated in the SA node, it travels via three atrial bundles to the AV node. These bundles are known as internodal bundles. Similarly, one bundle, interatrial bundle, conduct the impulse in a better way from right atrium to the left atrium. In this slide, we will talk about the atrioventricular conduction. As we know, atrial fibers are connected to each other and form a atrial syncytium. Similarly, there is a ventricular syncytium. These both syncytium are separated from each other by a fibrous sheet. They are only connected at one place through the AV bundle. So, as we have seen, from SA node, there are three atrial bundles. They come at this point. It is known as the AV node. This is the AV node. From AV node, one bundle arises and cross the atrioventricular fibrous tissue. This bundle, AV bundle, is also known as the bundle of His. Bundle of His. From bundle of His, the impulse travel further forward. Though the role of conduction fibers is to faster the conduction speed of the impulse, but the role of AV node is opposite. AV node slows the conduction and cause AV delay. The role of AV delay is to keep a short pause between the atrial contraction and the ventricular contraction so that atria will pump their blood in the ventricle and then ventricle will pump the blood in an efficient way towards the body. As we know, there is single conduction pathway between the atria and the ventricles. But sometimes, due to some congenital heart condition, some accessory pathway may appear, like the bundle of Kent. So, because of bundle of Kent, the impulse from the atria to ventricle arise early. Okay, this type of phenomena is known as pre-excitation, and it may lead to many tachyarrhythmias like supraventricular tachycardia or atrial fibrillation. This condition is known as Wolff-Parkinson-White syndrome. After atrial and atrioventricular conduction, let's focus on the ventricular conduction. So, once impulse arise in the ventricle from bundle of His, it will depolarize the septum from the left to right side, and then impulse depolarize anteroseptal region of myocardium towards the apex. After this, impulse depolarize the bulk of the ventricular myocardium from endocardium to the epicardium side. Then impulse depolarize the posterior portion of base of the left ventricle. After this, the ventricles are totally in a depolarized state. In this slide, we will try to find out the time taken by the ventricles to depolarize. So as shown in this slide, if impulse originates at SA node and this is the time 0.0, and the time given for the last cell of the ventricle to depolarize is 0.22 seconds, is 0.22 seconds. This is the last time. Now if we take ventricular depolarization from the bundle of His, then how much time it will take to depolarize from bundle of His? This we have to find out. Now as shown here, the time taken from SA node to AV node is about 0.03 seconds. So we can write internodal conduction takes 0.03 seconds. Now in AV node there is a delay of 0.09 seconds. So I will write AV delay is about 0.09 seconds. After AV delay, some time is required for the impulse to pass the bundle of His. So it is about 0.04 seconds. So in bundle of His or His bundle, it takes 0.04 seconds. So if we add all the times, it comes out to be 0.16 seconds. So it is the time required from the SA node to the bundle of His. So we can minus or subtract this time from the 0.22. That is the total time from the SA node to conduct at the last cell of the ventricle. So what we get, it is 0.08 second, and that is nothing but we will learn soon. It is the QRS duration that can be seen in ECG. I also want to emphasize one point here. As we know, this is the graph of cardiac potential. As the first cell of the ventricle here, let's say it depolarizes, and its cardiac potential is going like this. So how much time the cardiac potential will take to complete? It is about 300 milliseconds. Now we have seen the time taken by the whole ventricle to depolarize is 0.8 seconds. So this is about 80 milliseconds. So what we can infer from these times? We can say when the first cell of the ventricle starts depolarizing, it has not even completed its whole cycle. Even in 1/3 time, the whole ventricle got depolarized. Okay. Thank you. Thanks for watching.